to create effective advocates for a better healthcare system in the United States and elsewhere. As part of this program, we have a seminar series where we bring in various speakers. In previous years, that's been a live seminar, and this is the first time we're doing a Zoom seminar. We will continue to be doing these throughout the year, and so if you're interested in future ones, make sure that you've signed up for that information. I am very pleased today. I'm very excited to introduce Gary Schwitzer, who is the publisher and the founder of Health News Review, and this is a really incredible resource for journalists and for consumers, because it has had just an incredible effect on, because it has a critical view of the way that media is covering health stories. At its peak, Gary supervised 50 people who evaluated and graded daily health news reporting by major U.S. news organizations. And also there was a service there used to be a service available where people could actually have some stories vetted in advance, or news releases vetted in advance. So he evaluated and graded healthcare PR news releases. This Health News Review was honored with several journalism industry awards, including the Mirror Award, which honored those who hold a mirror to their own industry for the public's benefit, and also the Knight Batten Award for innovations in journalism. Gary Schwitzer was named to an adjunct associate professor appointment in the University of Minnesota School of Public Health. He has been on the faculty of the School of Journalism and Mass Communication and has taught health journalism and media ethics. He was also the founding editor-in-chief of the MayoClinic.com consumer health website. He was a television medical news reporter for 14 years, including positions at CNN. He was head of the medical news unit at CNN. And he's written about the state of health journalism in many different publications, including professional publications, medical publications, and publications aimed at consumers. Gary's also one of the assessors, along with Jeannie Lenzer, Shannon Brownlee, and me, on the list of industry independent experts, which is an ongoing, growing list of sources of experts that can serve as sources to the media. These are experts who do not have ties to the pharmaceutical or medical device industry. And it's really important that for media accuracy, they're actually relying on objective experts. So we think that's an important project as well. And just on a personal note, I have to say that I know that Gary has made many difficult decisions in his career that have always upheld the highest journalistic, ethical, and personal standards. I admire him so much. Gary he's a great thinker. He's a wonderful advocate and just a stellar human being. And I'm extremely honored that we have him giving this talk today.
Well, that is so nice of you, Adrienne, and glad to hear you mention the work that we do along with Shannon Brownlee and Jeannie Lenzer. It's tied into this theme of today, the perfect storm of politics, PR, and polluted messages to the public. You know, I wasn't headed in this direction. This is not what I wanted to do. I wanted to be a sports reporter, and maybe I should have been. Because, you know, in sports journalism, if you ever go to the sports pages, there is this wild obsession with statistics. There's the realization that one day, one game, one small sample of one's performance was never enough to rate performance on. It's reliable, predictable performance over time in sports that matters. But then as I was graduating from high school, this little hippie friend of mine, classmate, shamed me into doing something more important with my life than sports reporting. And so within a couple of years, I really fell into healthcare journalism, where oddly enough, too often, there is no obsession with understanding or explaining statistics, and where small sample size studies are often trumpeted as home runs every day. And I really did fall into healthcare journalism. I was in my first job at the NBC radio and television station in Milwaukee, and the news director tapped me on the shoulder one day. I was up to that time only doing things behind the scenes, writing for both the radio and TV sides, physically editing, cutting audio tape for the radio side, and physically cutting film for the TV news side. When he tapped me on the shoulder and said, "Kid, we figure you want to be on the air because everybody wants to be on the air. And here's your chance, and nobody else wants it. We're going to start a full-time medical news beat, and nobody else wants to deal with doctors full-time. So it's yours if you want it. If you don't want it, we don't know when there's going to be another chance." So, you know, the gun was sorted to my head. And for all the wrong reasons, I started down this path. I think a lot of general assignment reporters get thrown onto this beat, unfortunately, that way. But you know, I was fortunate. I did some things right at the beginning. I negotiated, I think, 2 weeks off, as it were, not reporting before I would start the beat, since I was new to this. And I hated math, and I didn't really care that much about science. I took 2 weeks to go around the Milwaukee healthcare community and talk with as many people as I could. And I don't think we often afford young journalists, even veteran journalists, that opportunity today. It's just go cover health news like you cover politics, like you cover the cops and courts beat. And I at least had 2 weeks to start to talk to people to find out where their heads and hearts were and where the issues were. So I headed down this path. But then after about 30 years in my career, I realized that, as with sports reporting, I wanted to track performance over time, performance of both science and journalism about science. Because, you know, media messages are what educate the American public about science, about medicine, about healthcare. Think about it. We don't get most of our healthcare information or education from our doctors, from our hospitals, what, from our insurers, from our universities, from the government? No, we get it from the media. So I thought that trying to improve healthcare journalism might be some of the low-hanging fruit. If we could influence even a few healthcare journalists to do a better job, perhaps those journalists would influence others in their organization. And indeed, I think that's what we accomplished over 15 years' time with healthnewsreview.org. I'm always quick to mention this was not my original idea. I benefited from a partnership with a project that I modeled this after, a pioneering program out of the University of Newcastle in Australia called Media Doctor, which started their effort in the early 2000s, 2003 or 4, and I began work on Health News Review in 2005. So Vi, if you could give me my first slide, please, we'll get into some of the background of the program. So for daily, and that included weekends, many weeks, over 13 years' time, we published on healthnewsreview.org before our funding ran out at the end of 2018. And we systematically reviewed news stories. This was not an off-the-cuff subjective assessment. It was as pure and objective and systematic a process, because it was criteria-driven, that we could think of. And so we reviewed more than 2,600 news stories in that time. Later, we picked up, as Adrian mentioned, the review of healthcare PR news releases, which is where this faucet of the flow of polluted messages often begins. And so we have a smaller number of PR news releases that we reviewed. We had published some 2,800 blog posts, and that is the one part of our publishing that I continue now myself, since I don't have the revenue to pay the wonderful team that I once had. We produced 50 some podcasts, and a small but significant source of pride, we produced not a perfect, but a pretty darn good toolkit of tips and resources to help people improve their critical thinking. And you can find that toolkit from the homepage of our website, or really at the top of any page of the website. There's a brown horizontal navigational bar, and one of the menu items there is toolkit, and that will get you into these primers. So the next slide, please. And these are the 10 criteria. What you're seeing are the 10 that we applied to the review of news stories. A quite similar list of criteria was used for the review of public relations news releases. And we had one simple eligibility criterion to be eligible for review. It had to be a media messages that included a claim about an intervention. So if it said something about a treatment, test, product, procedure, behavioral intervention, that was fair game. And you can see the list of what we looked at. So if it was making a claim, did you adequately discuss the cost? Did you quantify the benefits? And we'll get around to this a little bit later, but if you quantified but did so only in relative terms, not in absolute terms, that would get an unsatisfactory grade. And maybe I should just stop here and explain that, because not everyone may know what that means. The example I always point to, because it's a classic and it has good round numbers, when Merck marketed its drug for osteoporosis called Fosamax, what they marketed was what they said was the best of their clinical trials, that it reduced the risk of hip fracture in older women by 50%, 50. Well, whoa. But let me tell you, anytime you hear of an effect size more than 10, 15%, certainly 20, 30, 40, 50, you got to ask yourself two words: of what? 50% of what? And the truth is, although that was not a lie to say it was a 50% risk reduction, it was a 50% of one risk relative to another. In those clinical trials, they found that the risk of hip fracture was reduced from 2 in 100 women in the untreated group to 1 in 100 in the treated group, a risk reduction of 1 percentage point in that group. And it also gives you this nice round number of a number needed to treat of 100. You'd need to treat 100 women in order for 1 to benefit, and the other 99 would have to pay for it, run the not inconsiderable risk of side effects, and not know whether they would be the 1 out of 100 who would benefit. Of course, they wouldn't even know that that was how small the chance of a benefit would be, because they were told that it was a 50% risk reduction. So that's what we would look for with benefits. And the third bullet there, that's what we look for in harms. Interestingly, sometimes in news stories, because sometimes even within one journal paper, in order to make benefits look better, we use relative terms, and in order to make harms look better, we use absolute terms, because it might make the harms look smaller and the benefits look larger. We looked for how strong is the evidence, or did the story or the news release make a mouse study look like it was the same as a long-term 3,000 person randomized clinical trial? Was the condition exaggerated, or what many of us who are like-minded on this topic call disease mongering? We looked at the novelty of the idea. Was this really new, or is this the 6th erectile dysfunction drug that we're going to see on the market? And how is it any different? We looked at the availability. Is it available, or are you making a phase 1 drug study look like it's something I can run down to the corner drugstore and get? Are there alternative choices? We understand we're talking about news here, news releases and news stories, but in talking about the new, did you wrap the new into the context of what's already out there, and which by definition has a longer, more proven track record? And in the case of news stories, we wanted to see if the story relied solely or largely on PR news releases. And then finally, and this is one that's very close to Adrian's heart and mine, did the story quote independent experts, and did it disclose financial conflicts of interest? So let's go to the next slide, please. Here is the report card on the 5, it's kind of hard to do a cutoff here, but I thought going in that these 10 criteria were not equally weighted. I thought actually these were the 5 most important, and not surprisingly, they're the 5 for which both journalists and public relations people got the worst grades. So in the center blue column, we're looking at the grades for 2,600 news stories, and almost 70% got unsatisfactory grades for discussing costs. And I think journalists have to look in the mirror, and they don't have to take all the blame, but they have to take some of the responsibility for the fact that we don't talk about costs enough in this country. And maybe that's one of the reasons that we have a higher percentage of the GDP spent on healthcare than any other country on the face of the earth, double most other countries. And you can see that all the rest of those top 5, how well did you do in giving a sense of the scope of potential benefits, the scope of potential harms, evaluating the quality of the evidence, and discussing alternative options? In that blue column of news story grades, all 54 to 66% unsatisfactory. And then when you get over to the yellow column on how PR news releases did worse in every single category, including, I mean, look at that, 93% failed in the eyes of 3 independent experts. 93% of those news releases that we looked at failed to adequately address cost. But again, you know, if your idea of your job in public relations is to make your product, your institution, your key opinion leader, researcher look at his or her best, you're not really going to lead with costs, are you? You're not going to really lead with the best numbers on benefits and on harms. There's going to be spin embedded, and indeed, that's what we found. And then I think this is the last of my slides coming up. This is a record, folks, by the way. I've never done a talk with just 4 slides. But behind those numbers, if this were a one theme, a one slide talk, it would be this line, that we too often convey a certainty that simply doesn't exist. And in this pandemic era more than ever, and this is what just cuts me to my core, over and over again at all levels of communication, from the White House to federal agencies, to industry, to academia, to individual researchers, to public relations people, to journalists. We too often are conveying a certainty that doesn't exist. And those of us, news consumers and healthcare consumers at the bottom of the food chain, often have no idea we're even being spun. And so how do we do that? By using relative, not absolute risk data. And we'll have the example of convalescent plasma on that later in this talk. We don't explain the limitations of surrogate endpoints or markers. So maybe the classic in this case is LDL cholesterol, the so-called bad cholesterol. So we've had classic studies that have shown significant reductions in LDL cholesterol, but had no impact on the rate of heart attack or the death rate from heart disease. So what do we really care about? Do we really want to get the public obsessing about numbers? Did your test score go down? Or do we want to get them excited about evidence, if we ever have some, of the impact on heart attacks or on the death rate? And so the surrogates take the place of what we wish we knew if we could do the studies and take the time but they often don't tell the whole story. We convey a certainty, oh my God, using causal language to describe the output of observational studies that cannot prove cause and effect. That's not to demean their value. They can add to the evidence base, but they are not the highest form of evidence, and we cannot make, should not make causal statements based on the output of observational studies. We convey a certainty when we suffer from the tyranny of the anecdote. So often editors will tell their reporters, you got to have a patient. You got to get a patient to personalize this, to dramatize it. And who do you get your patients from? Well, most of the times it comes from the hospital you're dealing with, or from the PR people for that hospital, or the drug company or device company, or the PR people for the drug company or device company. And do you think they're going to give you their unsatisfied, their dropouts from the studies, the dissatisfied people, or the people who had a hard time complying with the regimen? No, they give you their prize patients, and therefore you convey a rose-colored view that may not exist. It may not be representative of the rest of the trial population. And then finally, we convey a certainty too often when we publish and disseminate single source stories when that single source has a conflict of interest, be it financial or intellectual. So, you can come off the slides now. Thank you for that. I want to be clear. I think that we are in simultaneously the best of times and the worst of times. I want to not give a nod to the good work that is being done by some of the big boys and girls in science, health, and medical journalism in this very difficult era, when the journalism industry is facing extremely difficult challenges and cutting back and forcing many of their reporters to meet quotas and to file their stories in different media formats. It's not just going out with pen and paper and returning to the newspaper anymore. It's, did you get digital images? Did you get digital sound? Did you get digital video? Did you post to the web before we post in the dead tree version of the newspaper? And so I do think that we are seeing some of the best in journalism. We're seeing some of the best in science. Some of the advances right now show what has been learned through the years to accelerate the pace of science. In journalism, it's always a little foolhardy to name names because it will be incomplete. But I think the Washington Post has been standing out. They have had some difficult times in the past decade. They should be proud of their coverage of the pandemic that I'm seeing right now. The New York Times, Kaiser Health News, ProPublica, Vox.com, the PBS NewsHour, many smart people, not all journalists, some great clinician researchers on social media. But I think all of that good can be overcome by the damage that's done in what I call the daily drumbeat of dreck, this crap that washes over the American public on many days and may overwhelm the good that's done by some of these excellent efforts that I've tried to highlight. In science, so I talked about some of the highlights, but the influence of politics right now in managing the science and managing the messages about the coronavirus shows us that we are in the worst of times, certainly the worst in my nearly 50 years covering these topics. And to hone in, last week's debacle regarding an emergency authorization announcement about convalescent plasma is almost a perfect example of the perfect storm and the putrid picture that gets painted for many of us almost every day. So we had the president, his press secretary, Alex Azar, the director of Health and Human Services, Stephen Hahn, the FDA commissioner, his PR person who'd been on the job for 11 days, a controversial hiring, all of them claiming that convalescent plasma cut the COVID mortality rate by 35%. They called it a major therapeutic breakthrough and a truly historic announcement. Of course, this was on the eve of the Republican National Convention. And of course, just the week before, two not too shabby federal health agency officials, Francis Collins and Anthony Fauci, had urged slow going on convalescent plasma, citing weak data from the country's largest plasma study. But see, that study was not a randomized clinical trial. It had no control group. And the huge enrollment in that program, the New York Times reported, has prompted a debate among researchers about what kind of empirical certainty is needed in treating patients in a public health emergency. The clinical director of the National Institute on Allergies and Infectious Diseases said the convalescent plasma program has, quote, ballooned to a degree that it is becoming unmanageable. And then yesterday, an NIH panel stated, quote, there are currently no data from well-controlled, adequately powered randomized clinical trials that demonstrate the efficacy and safety of convalescent plasma for treatment of COVID-19. So folks, there wasn't a reliable study to show a 35% mortality reduction. And if there had been, the statistics that was used and drummed into us repeatedly by Trump, his press secretary, federal agency heads, and their PR people was wrong. They were using relative risk reduction to get at 35%. The absolute risk reduction was something like 3 or 4%. 3 or 4 out of 100, not 35 of 100. But let's be clear, you can't even say that because of the uncertainty of the reliability of the data. And the more that convalescent plasma is now promoted for use outside of randomized clinical trials, the lower are the chances that we will ever truly know if or how much it works. And now, countless observers are questioning the integrity and the direction of the FDA. So, back to those pronouncements, this was not a major therapeutic breakthrough. And if there was anything historic about the announcement, it was historic in its absurdity. Now let's switch to the CDC. This week, former NIH Director Harold Varmus co-authored an opinion piece in the Times. It has come to this: ignore the CDC. I thought I'd never see this, but this is not your mother's CDC. This was about the CDC announcements that it has changed its testing guidelines to reduce testing asymptomatic people for the coronavirus. And in that opinion piece, Varmus and his co-author said the CDC, the federal agency that should be crushing the pandemic, is promoting policies that prolong it. So with a president who has consistently called for less testing, because as he said, you know, the more you test, the more you find, so let's stop looking. The smoking gun of political pressure on the CDC is unmistakable. Yesterday, the Trump administration said it won't join a global effort to develop, manufacture, and distribute a coronavirus vaccine, in part because the World Health Organization is involved and he doesn't like the World Health Organization. And it was a Georgetown professor of global health law who said, America is taking a huge gamble by taking a go-it-alone strategy. In short, this is the swamp that needs to be drained. And this is where journalism can play a role. And thank God it has been playing the role that it has been for the most part. We should be thankful for and supportive of the journalism that's shining a light on these issues. Our reliance on a vibrant, independent journalism industry has never been more clear. But there is a role for educators and for communicators and for caring and committed public health voices at this time. There's a battle underway for the hearts and minds of Americans. On the one side, it's being fought with fear-mongering, flame fanning rhetoric and alternative facts, as Trump advisor Kelly Conway liked to call them. On the other side, the battle is being waged with science, evidence, data, facts. And as we've seen, there's a lot going on in the middle between these two sides, like the federal health agencies and industry and PR people muddling the messages on many days. I never viewed our project, frankly, as a media watchdog project. So to those of you who are not journalists, you graduates who, I'm not sure any of these graduate students are journalism students, you don't need to be a journalist to do the kinds of work that we've done and that some of the others have done that I'll be pointing to. If, you know, the way I viewed our project, rather than a media watchdog project, was that it was really a rubber meets the road healthcare reform initiative. That if we don't improve the public dialogue, if we don't improve, I was going to say water cooler talk, but none of us can use water coolers anymore. Then I was going to say, if we don't improve talk over the back fence or around the Thanksgiving table, but we don't do any of that anymore either, although they are in other countries who got control over this. If we don't improve these discussions, we will never effect truly meaningful healthcare reform in this country. And so for you grad students on the call who are uncertain about direction you want to go with your career, I urge you to find a way in whatever you do to help educate the public. You don't have to be a journalist to learn from the messages in a terrific little book called The Elements of Journalism by Kovach and Rosenstiel. So some little gems from that book. The role of journalism, but it could be for all of us, and sometimes is. The role of journalism is to comfort the afflicted and afflict the comfortable. It's to give voice to the voiceless. It's to serve as an independent monitor of power. Sunlight is the best disinfectant, and we need to shine a lot more brightly, more often, on more science, medicine, and healthcare misinformation. So there are many ways to join these efforts. Nobody really asked Adrian, Shannon Brownlee, Jeannie Lenzer, and I to get together and create and maintain this list of industry independent experts. None of us got any additional funding. None of us has any more time in our days to have built this originally and to maintain it on an ongoing basis. We just thought it was the right thing to do, and we find time. What's at stake with all of this? Only what we call truth, only the reputation and integrity of science and of journalism. And clearly the stakes can't get much higher. So I had here a bunch of examples from our blog, my blog now, that we could go through. But Adrian, I really want to hear, especially from the students, and if anyone wants to point me back towards some of these highlights or lowlights from the blog, I'll pull those notes up and go through them with you. But I'd really like to hear people's questions and concerns and suggestions at this point, if that's okay.
Yes, thank you so much, Gary. That was wonderful. We've deliberately left a lot of time for questions, and